Okay. Hello, my name is Nancy, and today I'll be talking about the malpractice case that I chose, which is called Wide Awake. So, first off, I'll be talking about what malpractice is. Malpractice is when a physician or even a lawyer neglect their professional activity. There's a thing also called medical malpractice that only involve medical professionals. So, medical malpractice occurs during the treatment of a patient, and during the treatment of the patient, the physician or doctor don't do their job correctly and make an error, resulting in injury to a patient or an upset patient. Some of the medical errors that could occur is failure to diagnose, failure to provide correct treatment, or aftercare. So what do I mean by aftercare is the doctor doesn't tell you to come in for a checkup after surgery. Even if you complain about having pain, that is a medical malpractice because the doctor should have taken note that you were complaining and that you needed, more help. You weren't actually fully recovering. So let's talk about the history of malpractice. Malpractice actually goes back way, way back, years and centuries. And nurses used to be trained on the job at a nursing hospital, which is pretty interesting because if you think about it, nowadays most medical professionals need a 4-year degree or even more to become the medical professional that they are. But back then, these nurses were only trained at a hospital, and it's pretty crazy to think about. But this actually caused a lot of medical errors because these nurses were not medically trained or educated to be a nurse, to treat people. And without the knowledge that you need, could cause an injury to a person. And after that, they started making some changes in the system. Also, the first malpractice case occurred in 1794, where a male decided to do surgery on his wife, and he told his wife that he was able to do the procedure, but at the end of the day, ended up killing his wife on the table. In 1847, the AMA was founded and set the world's first national code of ethics. There were 9 code of ethics, and these code of ethics told people what was ethically wrong and correct for your profession or within your facility. And it better clarified the roles and responsibilities of these professions, whether it was a CNA or a medical assistant. So, yes, medical practice is a huge problem that is still occurring today, even if it was happening years ago and there's laws and regulations and code of ethics that have been put out there to help stuff like this to not occur as much. It's still occurring till this day, and there's still people dying. So malpractice cases can affect both the patient and the provider. It can affect the patient by upsetting them and even causing death. It can affect the provider by ruining their reputation or making them lose their license. It can occur to everyday people, including celebrities, like Michael Jackson and Julie Andrews. So, even if you think that, oh, I'll just hire the best doctor around because I have the money. Well, yeah, that you can do that and you may receive some of the best care. But there is no guarantee with money whether or not a malpractice case will occur. A Johns Hopkins study claims that more than 250,000 people die in the US every year due to medical errors. And medical errors are the third leading death in the US following cancer and heart disease, which is crazy to think about. So first, let's meet the patient. So for for this reason, I won't be discussing this patient's real name. I made up my own name and a made up hospital. So this guy, his name is Lucas Simpson. He was a 73-year-old male who was a Baptist minister. And keep that in mind because I might mention it again later. Lucas went into a Maple Apple hospital to get surgery done in his abdomen. And that's all he went for. And in this case, Lucas only went into surgery but was wide awake during the procedure. And I'll tell you what happens. Okay, so anesthesia. So in most cases, before going into a procedure or having any kind of surgery or anything done, you get anesthesia. Anesthesia is usually a drug that helps prevent pain or knocks you out so you don't feel what they are doing to you, because most of these procedures do end up causing lots of pain. In the surgery that Lucas did, he had to have two different types of anesthesia. The first was paralytic anesthesia, which prevents movement, and he is basically just paralyzed. He's not able to move. And the inhalation anesthesia prevents pain and causes a loss of consciousness. So that makes you go to sleep basically, and you aren't able to feel the pain. And in Lucas's case, he had two different types of anesthesiologists working for him. One was Jerry Tilley, who was an anesthesiologist, and then Robert Hill was a CRNA. Okay, so what actually happens during all of this? So Lucas goes in for his surgery. The doctor starts cutting near his abdomen, and everybody thinks that he's knocked out, he has the anesthesia that he needs, but actually he was only given one of them, the one to help to prevent movement. So it was basically paralyzed, but they didn't give him the inhalation anesthesia. So he was able to feel every little cut that they did to him. So he was in a lot of pain, and he was wide awake for it. Nobody knew that he was awake until 16 minutes into the procedure. They weren't able to actually give him the inhalation anesthesia until 29 minutes into the procedure. Now imagine what that may be, what that may even feel like. Like, I know maybe a paper cut may feel like a lot of pain, but imagine your whole abdomen area just being cut, them filling in there for 29 minutes. That's a long time and a lot of pain. Once he was given anesthesia, the anesthesiologist team actually decided to drug the patient with another drug. in order for him to forget whenever he woke up. They wanted him to forget about anything that happened because they knew that they made an error. And once the patient was back into his room and had woken up, the doctors never informed him about the error that was occurred. So the aftermath. So before Lucas actually was discharged from the hospital, he had told his doctors that he wasn't feeling okay. He was having these nightmares and was having some psychological problems. But the doctors nor nurses offered him any psychological consult, which they should have done because they kind of had an idea why these psychological problems or behaviors even occurred, which was their fault. Lucas developed some sleeping problems, some psychological issues, nightmares, and he kept thinking that he was alone and being buried most of the time. But after, 2 weeks, he actually decided to just commit suicide because he felt like he was tortured most of the time, which is very sad to think about because these doctors, it was their jobs to take care of him and to inform him and to consult and have a checkup with him. But they didn't do these things, and he just kind of overthought everything because these doctors, since they never informed him that it happened, he thought that he knew like he had some memory of it, but since the doctors didn't inform him, he just thought he made it up and was going crazy and ended up killing himself. So what Lucas actually had was anesthesia awareness, which is an experience where the patient who is under anesthesia will feel or remember their surroundings during procedure. So for example, you may be, in general anesthesia, you're knocked out, but during the procedure, you may actually remember some of the voices or things that these doctors said, or you might be a little bit awake during the procedure. Anesthesia awareness is not very common. It's pretty rare, and it affects less than 1% of the US patients. And up to 40,000 people will wake up unexpectedly during operations. And there's not a real reason as to why this happens, but it just kind of occurs to a small population of the people in the US. So after Lucas had passed away, their family decided to kind of investigate as to why their father or their husband had passed away or committed suicide. Because this wasn't like him. He was a Baptist minister. Keep that in mind. He was a Baptist minister. And he usually never had any problems, especially not psychologically. He wasn't ever depressed or feeling alone. So their family just wanted to ask his doctors, some friends, if they ever mentioned anything to him, or to, if they ever mentioned anything about anything going on in his life. And a doctor mentioned that Lucas may have been awake during procedure. And maybe the next day, a friend of Lucas said that Lucas had mentioned he was awake during surgery, but he had never mentioned that to his family. After both of them had said that, they decided to file a lawsuit. And keep in mind, some things have to occur before you file a lawsuit against anybody. So to file a lawsuit, there must be a doctor-patient relationship, which there was. Lucas was the patient, and there was the anesthesiologist and the surgeons who were operating on him, and that's the relationship that they had. There was a breach of duty. So the breach of duty is whether just if the physician or doctor, surgeon, anesthesiologist didn't do their job correctly, and that's actually what occurred. The anesthesiologist didn't provide him the correct anesthesia at the time, and injury caused by breach. So because of the anesthesiologist not providing the correct anesthesia, caused an injury to the patient. And is there evidence? Well, yeah, the psychological behaviors and issues that Lucas had at the end was the evidence for them. But for other cases, it can just be obvious things like a surgeon leaving a pair of gloves inside you, or a pair of scissors. That's the evidence. Once the lawsuit was made, the anesthesiologist actually denied the charges by the Simpson family. So they said that that didn't occur, or that they never did it. The settlement between the anesthesiologist and the Simpson family was not released publicly, but what we do know is that the anesthesiologists no longer work at the hospital. Now you may be thinking, well, what can I do as a medical professional to not get a lawsuit, or to not fall under a malpractice? Well, here's a couple things that you could do. Make sure that you get consent from your patient. Always tell them what you're gonna do, any risk that could happen. Always get a verbal and written consent, because that can be put into their chart or their record for later references. Always accurately and complete documentation. So always document what was said, what was done to the patient in their charts, and stay current and be prepared. Know what you're going to be doing once you go in, and just know what you're doing. And if you don't know what you're doing, just simply don't do it. But you can always ask for help, always get a second opinion before actually starting. Follow proper procedures. Make sure you're following all the steps and you don't skip things just because you want to get out of there. It's a very long procedure. Do what you have to do, even if it takes longer. And always establish a good patient-provider relationship. Always get to know your patient. Always talk to them. Make sure they feel comfortable. Have a good communication with them. And that's it. Thank you.